this is my second video.
Before you start the
In Greek,
second video, I think you are lucky that this one of the flanks of the ion-impelling forces didn't injure the retina.
No, yes, it fell down also and it didn't injure. I didn't want to use
Because
PFCL at that time because as Dr. Kelkar also showed some video, I'm very scared of PFCL. A little bit of more force, it goes here and there, and in an ERM case, I didn't want to take any risk, so I didn't use the PFCL there.
yeah.
in Greek mythology, once upon a time, Pandora opened a box which led to many unforeseen problems. I opened one such on this particular day. A 65 years old female patient was shifted to my OT with a decentered IOL. I planned to do an anterior vitrectomy and scleral fixation of the existing IOL. After anterior vitrectomy, one haptic was exteriorized and the assistant was asked to hold the haptic. The assistant pulled it a little hard and the haptic came out. Then a superior tunnel was made and the IOL was explanted. While doing the anterior vitrectomy, the other haptic was seen floating in the anterior vitreous. While attempting to take it out, it broke and a small piece dropped down. So I had no other option. I had to do a vitrectomy to remove the haptic. A 25 gauge entry was made through the existing scleral wound, as it was such hypotenuse that I could not take any other port. As soon as I entered the vitreous cavity, I saw vitreous hemorrhage. So thorough vitrectomy was done. PVD induced. While doing a peripheral vitrectomy with indentation, I saw a CTR. So a trial was made to remove the CTR. And the CTR was removed with a rotatory movement. So a complete vitrectomy was done. Even after 360-degree indentation, I could not find the broken end of the haptic, for which I actually started the pars plana vitrectomy. And then I planned to put an iris claw lens. So the day was finally getting over for me. But while putting the iris claw lens, the haptic of the lens broke. So I took out the lens. And I put another iris claw lens, this time successfully.
when we see these cases, each other's cases, the one thing that helps, the way it helps is that like your foreign body removal. If you see an animation, you can do a shake hand technique and take it out easily. That's the animation part. But I guess all of us have had this difficulty in taking out a foreign body, holding it in the direction of the exit. So this is something that happens to all of us, and expect that it's going to fall 2, 3 times, 4 times. So then your mind is at peace, because this happens to all of us. And the iris claw lenses, retrofixation iris claw lenses, are notorious for this particular thing.
Before inserting the iris claw lens, it's always better to see outside whether the claws are working properly. And sometimes if there is some defect, we can discard it and put a fresh one.
Also, if one is already hooked and the other is broken, then what is the way to remove it?
Yeah,
Cut
it's
that
very
piece,
difficult,
right.
extremely difficult. In sometimes we need to cut the iris. That's the main problem with the iris claw lenses. One side stuck, meant stuck, and the other, if it is broken, then you have to discard the lens and put it. It doesn't happen actually. That's doesn't open up. Means once it is enclaved, it is enclaved. It does, and it's good. Anyway, it's bad when you need to replace it.
And one thing, one mistake which I felt that I did was, I was in the OT and the patient was sent to me that do this surgery. One very senior surgeon sent the patient to me that do this surgery. I was like, okay, I did a quick IO in the OT and I started. I didn't indent, I didn't see anything. So had I indented it first, then I would have seen the CTR and planned it like that. But everything was a surprise for me during the surgery.
So it's a message to the anterior segment surgeon to properly inform the posterior segment surgeon.
Also, yeah, go.
Yeah, yeah. Thought about it. Yeah, leave it. Better to leave it. Main tunnel. Yes.
Also, when you are clipping the iris claw, the iris clip and the side port were not in the same way. You went obliquely. So you do that always, or?
No,